People in car and motorcycle accidents are often diagnosed with cervical strain or cervical sprain. In simple terms, their neck hurts. But there's a lot more, and the two injuries sound the same, but they are very different. Also keep in mind that you can have both strain and sprain from the same accident. So let's dive right in. What is cervical sprain and what is cervical strain? A cervical sprain involves injuries to the ligaments in the neck, while a cervical strain involves injuries to the muscles or tendons in the neck. These are common injuries often seen in car accidents. A cervical sprain occurs when the ligaments in the neck, which are strong bands of fibrous tissue connecting bones to provide joint stability, are stretched or torn. Whiplash, caused by sudden neck movements, like those in car accidents, is a frequent cause of cervical sprains. Whiplash-associated disorders can lead to significant ligament damage, particularly in the cervical spine. A cervical strain, on the other hand, involves injury to the muscles or tendons in the neck. Tendons are fibrous cords that connect muscles to bones. A strain happens when these muscles or tendons are stretched or torn, often due to overuse, sudden movements, or poor posture, like cradling a phone between your ear and shoulder for long periods. Muscle strains are commonly linked to repetitive stress or acute trauma. To break it down, a sprain affects ligaments, similar to a twisted ankle but in the neck, while a strain affects muscles or tendons, like a pulled muscle but in the neck. Despite affecting different tissues, the symptoms of cervical sprains and strains are often similar. These can include neck pain that worsens with movement, stiffness, reduced range of motion, muscle spasms, headaches starting at the base of the neck, and pain in the upper shoulder area. In some cases, people may also experience irritability, fatigue, difficulty sleeping or concentrating, numbness or tingling in the arm or hand, or weakness in the arm. These overlapping symptoms can make diagnosis tricky without imaging or clinical evaluation. In summary, the key difference is the tissue affected: ligaments in a sprain and muscles or tendons in a strain. However, the symptoms and causes often overlap. If you experience neck pain, it's always best to consult a healthcare professional for an accurate diagnosis and appropriate treatment plan.
The Law Office of Daniel Horowitz represents people injured in motorcycle accidents. We have accident and medical professionals on staff to document all of your injuries. Call us at 925-283-1863. There is no fee until you recover money. Again, our number is 925-283-1863.